The skin is a multifunctional organ and the largest in the body. It has many functions, but its fundamental role is to provide a protective interface between the external environment and an individual's tissues, providing shielding from mechanical and chemical threats, pathogens, ultraviolet radiation, and even dehydration. Joining me now in Studio 4 a discussion is our regular guest, Dr. Paulo. And Paulo, we're going to be diving into skin, so it's always an exciting one. Skin we see as, we talk about it being the largest organ of the body, covering everything, but it's very, very important, and I think we often take it for granted. We put a lot of stuff on our skin, but don't think about the inside. So what is the role of nutrition when it comes to the health of our skin?
It's vital, obviously, it's vital. There are many aspects. We can mention two in terms of collagen production, for example. Collagen is that structural protein from which the structure of the skin is made. Also in terms of the cells that are predominantly part of the epidermis, the upper layer, they are known as keratinocytes. They differentiate into different types of keratinocytes, and nutrition is vital for that differentiation. Okay. And we know that there are many diseases that have to do with vitamin and mineral deficiency that affect the skin. Okay. So nutrition is vital.
But now, Paulo, in terms of nutrients getting to the skin, what is that how does that work?
Well, the skin has got two layers, the dermis, the lower layer, and the epidermis, the one that you touch. The thickness of the skin, 90% of it is the dermis, the lower layer. So the surface you touch is only the top 10%. The dermis, the lower layer, is vascularized. So it's got blood vessels, which is the normal way that nutrients get to tissues, to cells. The epidermis, the upper layer, does not have blood vessels. So there starts the challenge. The nutrients have to come from the dermis by diffusion. Because of the structure of the epidermis, the outer layer, the lipid content that gives it structure, the extracellular fluid, which is normally present between cells, is not the same as in other tissues, so that also compounds the problem. Okay. So basically, it is not an easy transfer of nutrients. So that's something which one must keep in mind.
Okay. So now, vitamin C is a nutrient that or a vitamin that we know is very important for immune health, but it's also very important for skin health. What is the role of vitamin C in the skin process?
Well, just before I give you the role, to give you an idea of how much vitamin C is in skin, for example, if we compare the amount of vitamin C in adrenal glands, and we measure this in terms of so many milligrams per 100 grams.
Right.
Okay? So adrenal glands have somewhere between 30 and 50 milligrams per 100 grams, and they are considered to be the organs in the body that usually have the most vitamin C. The epidermis has anything from 6 to 64 milligrams per 100 milligrams, whereas the dermis has about 3 to 13 milligrams. Also, the amount, given that the amount of vitamin C in skin is pretty high, it's higher than that in plasma, in the blood, which means that there's an active accumulation of vitamin C. Okay. In terms of function, we can look at structure, for example. So it is vital it is a cofactor for substances that are used in the production and the assembly of collagen. Okay. It is very important, as I said just now, for the differentiation of keratinocytes, for them to become the type of cell that they must be, which contributes to the barrier function, for example. In terms of structure as well, if you have a cut from the dermis, there are cells called fibroblasts that come to repair the damage, and vitamin C is crucial for that. In terms of genetics, it is crucial for the expression of collagen genes and antioxidant enzyme genes. And then also, as an antioxidant, as you mentioned earlier, in terms of the immune system, it protects skin cells from UV radiation, ultraviolet radiation, and from ozone exposure, which causes the death of skin cells as well.
And then what is the sort of bioavailability and uptake of vitamin C for use in the skin? Well,
to give you an idea of how important vitamin C is for the skin, there are two main transporters of vitamin C in tissues. They are known as SVTC1 and SVTC2. And most tissues express SVTC2. The skin expresses both. Okay. Especially the epidermis, the upper layer, which shows you that it needs to have in place the means to acquire as much vitamin C as it can.
Okay, because it's working double time.
Correct. So that gives us an indication. Human studies have been done on supplementation, for example. So they measure the average levels of vitamin C in the skin. They're supplemented for 6 weeks on in this specific study that I'm thinking of, 3 grams, 3,000 milligrams a day for 6 weeks, and they found the levels to double.
Okay.
So there is an active uptake of vitamin C, which responds to supplementation.
Yes. So in terms of supplementation, that's one aspect in terms of sources, but from a general dietary perspective, what are the challenges of maintaining sufficient vitamin C that we are protecting our skin and making sure we've got enough?
All right, so first of all, vitamin C is an essential vitamin or substance. In other words, your body does not make it. That's what essential means. It means it must come from the outside somehow, normally through the diet. Fruits and vegetables contain vitamin C. Animal products do not contain vitamin C. So there is the one challenge. Fruits and vegetables are not in
not so well subscribed
in fast food, if I can put it that
absolutely.
way. All right, and then of course there is supplementation that you can use to obtain the necessary levels.
Right. So Doc, we've put into our Real Health Medicine cabinet Biomax Vitamin C liposomal with Quali-C, which is from Coin Healthcare. What makes this particular product a good solution for a quality vitamin C supplement?
Well, it's got Quali-C, as you've just mentioned. Quali-C is the brand name of the vitamin C that comes from Scotland. It's a family-owned business. I think they're now 75 odd years old.
Okay.
And it's considered the best source of vitamin C, or the source of the best vitamin C in the world. Then this specific product has got a liposomal delivery system. Remember, we spoke about the liposomes, the little fat-like particles that envelop the vitamin for delivery. Now, traditionally, liposomal delivery systems are liquid systems. This is a new patented system from the top liposomal company in the United States. It's called Cell G8, and it's a dry powder system.
Okay.
So it's sort of a step up on the liquid system. So it's the best quality vitamin C, and it's got an excellent delivery system which maximizes what you actually get from what you take.
And then, of course, we always talk about the benefit of vitamin C. So just give us an overview of some of the other benefits of supplementation in vitamin C.
Every single organ uses vitamin C. There are countless metabolic processes that use vitamin C. So something very important that we must keep in mind is that there is, in terms of vitamins or minerals or any other substance, when it comes to deficiencies, there is what one might call an overt deficiency. That's the level at which you have overt symptoms in disease. We might give it a name, like scurvy.
Yes,
for vitamin C, we'll call it scurvy. But that is a very deep deficiency, if I can put it that way. But then there are relative deficiencies. So for the sake of example, let's say that 100 is what you must have, and if you get to 80, you get scurvy.
Yes.
Or rather, if you get to 20, you get scurvy. At 21, we don't have symptoms of scurvy. Are you deficient? Of course you are. You just don't know it because you don't have
aware of it.
Correct. Yeah. So there is a range of a relative deficiency, and it's because of this relative deficiency over the period of your lifetime that not everything that requires vitamin C gets done on a daily basis.
Okay.
And when that has gone on for 45 years or 50 years, well, eventually things are going to start breaking down.
You've got deterioration.
Yes, correct.
Yeah, right. And Paulo, is this something that is safe for everybody to take, no matter age, medications that it might interact
everybody
with?
can take it. The only issue with vitamin C is the dosage. At a certain dosage, your digestive system, your intestines will tell you this is too much and you would have diarrhea. Okay. And that, on average, is somewhere between 10,000 and 12,000 milligrams. There may be people. Dose. Yeah, it's a very large dose.
Yeah, okay. And available?
It's available, as far as I understand, from health shops and pharmacies.
Wonderful. Paulo, thank you so much. A lovely, different discussion around vitamin C. So thanks for joining us.
Pleasure.